Democrats in Congress of all stripes say they want Americans to have affordable health care, but there are real disagreements in the House Democratic caucus over how to reach that goal. Some want a so-called Medicare for all single-payer system with no private insurers. Others suggest creating a public insurer option which would compete with but not replace existing insurers. So I want to hear where all of you stand on that. Ms. Connell, I'll start with you. Do you support or oppose abolishing private health insurance and replacing it with a government-run health plan for everybody?
I do think that we need to move into Medicare for all. Right now, healthcare is very expensive for Americans, especially for Rhode Islanders. I would say that my parents depend in health insurance every time. And the pharmaceuticals are really profiting on people instead of saving lives. My dad takes a medicine that is called Revlimid, and I thought that it was $10,000 a month. And now I checked today, it was $25,000 a month. That's not about saving lives. This is about making profit for corporations, and I am for Medicare for all.
I'm going to go to Mr. Regenberg. Do you support, I think I know the answer, but do you support abolishing private health insurance, moving to a government-run plan for insurance?
Healthcare should be a fundamental human right for everyone. That's not how it currently works in this country. Right now, healthcare is an opportunity for corporations to profit off our injuries and illnesses. I'm proud to be the only candidate in this race who has an actual record of taking on big pharma and health insurance executives to push for Medicare for all. I fought for that every year I was in the General Assembly. I'm proud to be supported by folks like Senator Bernie Sanders, who was here on Sunday to rally for our campaign, who's been leading this fight. There are so many people struggling right now, struggling, as Senator Cano said, to fill their prescription drugs because of big pharma price gouging, struggling with the cost of health insurance continuing to go up and up. And meanwhile, big pharma CEOs, health insurance executives are making higher profits than they ever have. That is barbaric, and I think we have a responsibility to fight for Medicare for all. I think pragmatically, we're not going to pass Medicare for all in one fell swoop. I think the way to do it is by lowering the Medicare eligibility age as far as we can when we have the political capital, maybe down to 55, then down to 50, down to 45. We're building the constituency of folks who are invested in this, who understand that this system helps them, and we'll be able to actually, I think it's, people call this a pipe dream.
I'm going to let everybody in on this, but I want to keep bringing people in. Ms. Matos, your position on this?
My position is that we should have Medicare for all who wants it. If there's anyone that would like to have a different option, they can have the money to pay for a expense insurance, they can go for that. But we should have Medicare available for everyone. Everyone should have access to medical care. When you are trying to figure out how to pay your bills, and I can tell you, as someone that has a pre-existing condition, I'm so glad that we have the Obamacare in place. We have to strengthen the Obamacare, making sure that it's expanded to cover more people until we're able to have Medicare for all.
We're going to go back and forth. Mr. Burbrick.
Yeah, look, can you hear me?
Yep. You're good.
We can hear you. You're good. Healthcare is a human right. And look, my folks were paying almost $3,000 a month and between premiums and prescription drug costs before they jumped on the Affordable Care Act. But we also are a nation of freedoms and choices. And I believe people should have the choice of whether or not to go on the public option or pursue their own private option. But we need to strengthen the Affordable Care Act to make sure that it works for Americans who need it in times of need.
And just so viewers at home, I believe we're using our backup microphone for Mr. Burbrick, just so they understand. Thank you. Mr. Gonsalves.
So we're paying exorbitant amounts of money for health care in this country, to the likes that no other country in the modern day world is experiencing. And this is coming down to putting people first. The price gouging that we're seeing with the pharmaceutical industry is something that we need to address head on. Look, I was just in East Providence recently, and I spoke to a woman.
Just to get the clear answer off the top, do you support
absolutely Medicare for all? But this is an important story because this is about people.
Briefly, because we have a lot of candidates on the
This woman went to an emergency room, and she was there for 6 hours. And she walked out with a $17,000 bill. Our healthcare system isn't working. We need to fix that. And it's not just Medicare for all. We need Social Security expansion. So the Social Security Expansion Act is something that I would also support at the federal level.
Thank you. Ms. Quesada.
We're talking about the richest country in the world, and it's unbelievable. The people has to. I had a young man who had a car accident, and he refused to go to the doctor because he was afraid of the bill that his parents was going to get, and he died the next day. We're talking about the United States of America. We should have Medicare for all, and we have the way to pay for this. Then I'm definitely agree we should go for Medicare for all, for
Mr.
everybody.
Kate. Thank you. Mr. Casey.
Medicare for All is a failed system. Okay, it was tried in Bernie Sanders' home state in Vermont. The state of Vermont had the highest number of people that were insured. Had the highest number of people that were insured. They also had per capita one of the healthiest populations, and that system failed dismally. I think what we need to do, and we can't, it hasn't worked anywhere. We're going to bring that system for the United States. We want to try something that hasn't worked. Okay, I think what we need to do is have a public option, so that we have insurance companies that are going to compete for business, they're going to drive down costs, and we're going to have better patient outcomes.
Mr. Amo.
I am in support of investing and doubling down on the progress of the Affordable Care Act. One of the most proud moments I've had in my political career was helping on the implementation of the ACA when I worked for President Obama, enrolling people in health insurance for the first time. But what I would say is we do need to be practical about the reforms that we might be able to achieve. I do think lowering the Medicare eligibility
But the question is,
age,
do you support
or
oppose abolishing private health insurance and moving to one government-managed plan for everyone?
I would not abolish private health insurance. I would have a robust public option and look at the political realities that we face and try to get as much as we can to make sure that everybody has access to health care.
Tim?